Good morning, everyone. My name is Miss Sonu, Assistant Professor in IIMT College of Pharmacy. Today, the topic of my session is cardiotonic or cardioglycoside. The topic we will cover here, the definition of cardiotonic, pathophysiology of congestive cardiac failure, aim of cardiotonic, source of cardiotonic, mechanism of cardiotonic, pharmacological actions that are cardiac action, extra cardiac action, side effects, therapeutic uses, contraindications, digitalis interaction. Now let's start with the definition of cardiotonic. So cardiotonics are the drugs which increase the contractility of the cardiac muscles without increase in the myocardial oxygen demand. The cardiotonic are also called as inotropic drugs. Cardioglycosides are come under the cardiotonic. That's why cardioglycoside also called as cardiotonics. Now, the definition of cardioglycosides. Basically, cardioglycosides are a group of steroidal compounds that can increase cardiac output and affect the electrical functions of the heart. There are some examples of cardiac glycosides that are digitoxin, digoxin, bufalin, and obein are the common cardiac glycosides. Next is pathophysiology of congestive cardiac failure. Our cardiac membrane is lipoproteinous in nature. Normally, sodium ions are concentrated extracellularly and potassium ions are concentrated intracellularly. When the sodium ions level fall, the sarcoplasmic reticulum, which store calcium ions, remain inactive, which cause low level of calcium ions, and that leads to weak myocardial systole, and this cause accumulation of blood in the ventricles, which leads to ventricle distension, and our heart tries to try to expel this accumulated blood volume, and then heart gets exhausted and fails to work. This failure due to accumulation of blood volume is defined as congestive cardiac failure. Now, the aim of cardiotonic or cardioglycoside, the drugs used in the treatment of congestive cardiac failure should act in the following way. First is by reducing the cardiac workload, by relieving the pulmonary congestion, by increasing the force of contractility, should increase the cardiac output. Cardiac glycosides are used in the management of congestive cardiac failure. The sources of cardiac glycosides are obtained from the dried leaves of plant Digitalis purpurea, also called foxglove, and their other are source that is white foxglove, Digitalis lenata, Strophanthus gratus, Strophanthus combi. Next is the mechanism of cardiotonic or cardioglycoside. The cardioglycoside effect on cardiovascular function in the congestive cardiac failure, the digitalis derivatives, when administered to the individual suffering from congestive cardiac failure, it act directly on the myocardium and increase the conductivity of the heart, automaticity of the heart, rhythmicity of the heart, and causes forceful contraction of the heart. Because of powerful contraction, ventricular blood is forced from right side into the artery, and from left ventricle to the aorta. This cause completely empty of the heart. This is the second mechanism of cardioglycoside or digitalis. Digitalis derivatives block the sodium-potassium-ATPase enzyme and improve the level of sodium ions by increasing the sodium plasma level. Then it activates sarcoplasmic reticulum, which release the calcium ions. Then the calcium ions combine with the cardiac muscle, which cause forceful contraction, and it leads to complete empty of the heart. It then thus relieve the congestion and restore the myocardial function. Thus derivatives, digitalis derivatives, by acting direct and indirect action, it improves the force of contractility and thereby assure complete empty of the heart. Thus, digitalized heart can do work with less energy expenditure or more work with some energy expenditure. Hence, digitalis is defined as cardiotonic. Now, the pharmacological action of the cardioglycoside, that are cardiac action on heart. First is automaticity. Digitalis increase the ability of Purkinje cells and the ventricular muscles to initiate the impulse. Second is conduction velocity. The conduction velocity is slightly increasing the arteria or atrium and ventricles by the small doses of digitalis. Third is blood pressure. Digitalis increases the mean arterial pressure in the normal individual only. Fourth is heart rate. Digitalis does not affect the heart rate in the normal individual but reduces it in congestive cardiac failure patient. Now the extra cardiac action on kidney. Digitalis increases the rate of excretion of sodium and water by kidney and thus exert as diuresis. On GIT tract, gastrointestinal tract, the dose of digitalis produce diarrhea, nausea, and vomiting. Now, the side effect of the cardiac glycoside. First is anorexia. Anorexia means the loss of appetite, nausea, vomiting, diarrhea. It also causes headache, fatigue, insomnia, yellow and green vision, blurred vision, cardiac arrhythmia. These are the side effects of cardiac glycoside. Now the therapeutic use. So therapeutic uses of cardiac glycoside. First, it is used to treat the heart failure. Second is to treat the arterial fibrillation. Arterial fibrillation means an irregular, often rapid heart rate that can lead to the blood clot in the heart. Third is to treat the arterial flutter. Arterial flutter, it is a condition in which the heart in upper chamber arteria beats too quickly. Fourth is to treat the paroxysmal atrial tachycardia. So it is a type of arrhythmia or irregular heartbeat. Now, the contraindications. Digitalis is strictly contraindicated in the following clinical condition. First is myocardial infarction. The myocardial infarction, it refers to the tissue death of the heart muscles caused by the ischemia. Second is ventricular tachycardia. It is a heart rhythmic problem caused by the irregular electrical signals in the lower chamber of the heart. Third is partial heart block. Fourth is previous digitalis therapy. And fifth is calcium administration. Next is digitalis interaction. So first, when we take on digitalis and calcium together, it is known that the calcium ions increase the force of contraction of the heart. High plasma calcium level stimulate the myocardium so much that it leads cardiac arrest during systole. Digitalis is also known to increase the force of contraction of the heart. Thus, digitalis and calcium act synergetically and may prove to be toxic. Hence, during the digitalis therapy, the calcium ions administration must be avoided. Second is digitalis and quinidine. Quinidine, when administered in individual taking digitalis, increase the serum digoxin level. This may cause adverse effect of digitalis and other clinical complexities, hence must be avoided. This is all about cardiac glycoside which we are discuss here. Thank you everyone.